But first, concerns are growing around the world with reports of multiple mutations of the Covid-19 virus. The UK earlier this week reported a new and more contagious strain. Soon after, South Africa also reported a new variant. Now, closer to home, Malaysia's Health Ministry said that it has identified a new strain from samples taken in Sabah. And just yesterday, Singapore reported one case of the new strain from the UK. The patient is a 17-year-old Singaporean girl who had studied there. Joining me now to weigh in on this is Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health. Professor, thank you so much for coming on to the show. Prof, since the start of the outbreak, we know that the coronavirus has been mutating, but reports are saying that these latest strains seem to be much more contagious. How worried should we be, and how can we get ahead of the virus?
Thanks for having me back. It is a cause for concern in the sense that this strain is much more infectious than earlier dominant strains and also appears to infect children just as easily, although we do need more data on this. Previous strains are actually less infectious to children. Now, whether these new strains are more likely to cause severe disease, it's something that scientists worldwide are currently studying. And at the same time, vaccine companies are also conducting research to ensure that existing vaccines remain just as effective against the new strain. The understanding presently is that it will not affect vaccine effectiveness. But I think it's important to highlight that this is still early days. We need to understand more about the new strains before determining the likely impact and the appropriate policy decisions that need to be taken by governments. Now, that's why we strongly encourage that individuals, everyone, remain vigilant with mask wearing, social distancing, and to avoid large crowds and large social gatherings. Governments are concerned because of the impact that it has in managing the spread of COVID-19 in the community and also any potential impact on vaccine effectiveness and border control measures. But for individuals like you and me, as long as we continue to diligently practice the necessary safe management measures, actually, there is no need to be overly concerned with these new mutations.
Right. And that's it, Prof. Will these new strains of the virus affect us in returning to normal? Will there, be a need to change anything to our safe management protocols?
So, if the new strains actually clearly do not affect the effectiveness of the vaccines, then the plans on relying on the vaccine as an important step towards protecting the population will continue to remain feasible. And presently, the understanding is that the new strains are still transmitted between people in the same manner like the old strains, just that it becomes easier to infect another person because a person infected with this new variants may have a higher amount of virus present in the person's upper respiratory tract. And that is why, as long as one continues to wear the mask properly and maintaining the necessary social distance, this remains the same measures to minimize the chance that an infected person will pass on the virus to someone healthy. Now, because the new strain is more infectious, what this may potentially mean is that we will now need to encourage even more people to come forward to take up the vaccination when it is available to them. Because this is the only way we can continue to ensure that the community as a whole is protected. So instead of aiming perhaps for a target uptake of 80%, we may be now looking at 90% or even higher.
Prof, let's talk about something else. There were several reports as well in the past few days about breaches of safe distancing measures. Now, the holiday season is upon us, and typically this is the time where families and friends have gatherings. What is your advice for residents ahead of the festivity?
Well, sounds like a wet blanket, but I would like to remind everyone that Singapore continues to see the occasional community transmission. And this means that there are people within the community that continue to be infected and they pass on these infections to others. Occasionally, some of these people will end up with more symptoms, and that's why we find these community cases. And there are enough reports from overseas that families that came together for large gatherings for a time of happiness and fun actually ended up with some bad news that number of people were infected, some actually with very bad health outcomes. So the present rules in Singapore are meant to avoid such unhappy situations. And this means that before the 28th of December, social gatherings in public should not be more than 5 people. And if you're hosting visitors at home, there should be not more than 5 visitors at any one time. So the recent reports of people breaking their rules clearly remind people that the government remains very strict about enforcing this. So I think it's important to remember that by keeping to the present rules, you're helping to keep yourself, your family, your friends safe. The rules are there to actually protect you and me. If we don't follow the rules simply because we think that we can't be so unlucky to be infected, this is precisely when gaps happen in the community and super spreading events start. And we've seen enough from overseas that incidents like this do happen. So if you're keeping to the rules and then enjoy yourself with your family and friends, celebrate a happy Christmas and New Year. I'm sure many of us found this year to be extremely stressful and challenging. And I think this is the time we show our appreciation and thanks to our family and friends who have been supporting us. So here's wishing you an early Merry Christmas and stay safe, everyone.
Well, thank you so much, Prof. Teo. Always a pleasure to have you, and thank you once again for setting aside time to speak with us. That was Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS.